for the patient Shawn. He is a 45-year-old man with a history of Crohn's disease, and he just recently had an ileostomy procedure and is left with a stoma. He also appears to be dehydrated, and he has an allergy to Reglan and morphine. He weighs 165 pounds and is 68 inches tall. So for interventions, he recently went under surgery to address the pain and the side effects that come with his Crohn's disease. He will now have to live with a stoma and need to learn how to take care of it and avoid complications. He will also need to learn what he can handle eating and will need guidance in that area from a dietitian just to figure out what foods he can handle now. There might be more foods he can handle, but some things might still cause trouble, so just he needs to figure that out. And he needs to eat 1,929 calories a day to maintain his weight. And based on his BMI, he seems like he might be slightly overweight, but I don't know like the amount of muscle he has, which might make him weigh more without being an issue. I don't think that weight bias was present with this patient. So there isn't really any weight bias to address, but I would want to let the patient know that he's just barely overweight, and now that he has a stoma, he may start feeling better and he may gain more weight as he starts eating more, but that wouldn't be my focus with him because I want to focus on his stoma and his gut issues. So when counseling him, I would ask him what they might be excited to try now that they're feeling better, and encourage them about the stoma and that it will improve their quality of life and help them have less pain daily. And then I'd want to discuss how they can try foods just to see what they tolerate and what may cause more gas pain or what may not, and just figuring that out, trying things one at a time. And then a strategy to decrease weight bias in the healthcare setting. It can be beneficial for those pursuing a career in this setting to spend time and create memories with people who tend to be in groups that get stereotyped. This can reduce bias by reinforcing positive emotions towards specific groups, and just by spending time with these people, they will, hopefully just see that they're just regular people and that they don't have to look down on them, and just see like that it will help them see that they may have had a bias before, and it might help them get rid of that bias, knowing that if they have friends that are in this category of people. Thank you.